I'm about to give a keynote on the future of oncology at this Pfizer-sponsored event here in Tallinn, Estonia. The question is, what are we going to see happen over the next 20 years? What's extraordinary is the improvement in cancer therapy which has taken place over the last 20 years. So in a country like the UK, for example, around 70% of all tumours diagnosed this year will be cured. And that's not just solid tumours, actually, it includes leukemias as well. That's an astonishing change, and every single year we're seeing further improvements. And what's causing this? Well, it's lots and lots of different things, but it's different specialties working closely together. It's about accurate diagnosis, using gene tests to type particular tumours, to make sure that we got the right treatment matched to the right patient at the right time. It's about making sure that treatments happen in the right sequence, so radiotherapy before chemo. It's about getting the periods of treatment right. It's about using next generation drugs to stimulate your own immune system to identify targets for destruction, to make sure the immune system sees cancer cells. You see, around every single tumor inside every person's body who has cancer is an immune reaction. You can see it under the microscope. But the problem is that the cancers are often multiplying more quickly than the immune system can destroy them. So what we're talking about is shifting the balance, enabling cancer cells to be detected more rapidly, enabling T cells, which are the white cells which destroy cancer cells, to operate more effectively. It's enabling the lymph nodes to work more efficiently without deciding to attack the body at the same time. It's a fine call, because if you have an immune system which is too active, you start getting autoimmune diseases. But since cancer is itself coming from your own tissues, you need some kind of autoimmune response to kill cells which are actually your own flesh and blood. This is an extraordinarily difficult thing to get right. So with some of these immune therapies, we have side effects where the cancer is not just being attacked, but healthy tissue as well. So we need to be extraordinarily careful. We're going to see progress with viruses attacking cancer cells, targeted to the surface coatings of particular tumours. These are all very exciting technologies for the future. And another thing is this, that while we talk about the rising costs of healthcare, and while it's true that healthcare costs as a whole have gone up in every single country and every single year for the last generation or two, the fact of the matter is that every single one of the most expensive and exotic drugs in the world today is going to fall off a cliff in the next 10 to 15 years by about 95%. We're talking about a 95% cut in the costs of these things because the patents expire. And once they do, you see for the smaller molecules, generic manufacturers, you see for larger molecules, biosimilar manufacturers coming in to flood the market with very, very low cost alternatives. Now that's very good news in a region like this, where we've got the former Soviet bloc, Russia, Estonia, Belarus, Ukraine, Czech Republic, Slovakia, and so on. Nations which have much smaller health budgets per person than in a country like Germany, but nevertheless have huge aspirations for the future. And the fact is, with this 95% fall in costs for these very exotic medications, even in the less wealthy parts of the world, we're going to see a huge increase in access to treatments that were only 10 years ago felt like science fiction. So, extraordinarily interesting time to be in oncology. But the most important thing is this, that the smaller things can often make the biggest difference. So it's making sure that a patient isn't lost for follow-up, making sure that a new diagnosis is seen in 2 weeks, and that the letter actually arrives in time for the patient to get their appointment into the diary and get there, and making sure that the right teams of people are available at the right time to see the patient on the same day without them having to come back over and over with extra delay. So fast, effective diagnosis, streamlined treatment, these are the things which underpin the future of oncology alongside the most exotic treatments the world has ever seen.